Pre-COVID, we knew that 66% of healthcare workers were facing burnout. As healthcare providers, we're notoriously bad patients, and we can give great advice, but we certainly aren't taking it ourselves, even especially as self-care goes, and burnout prevention and resiliency training, things like that. We just do not do the job that we should, taking care of ourselves the same way that we're taking care of other people. We can't control a lot of these things, but what we can control is what we do before we show up to work, how we care for ourselves to keep ourselves going, how we recover from, a death of a patient or a really hard day at work. And instead of pushing that down and just going through the motions, I started experimenting with what I could control. And I saw such a huge change in my life and in my career and how I cared for my patients and how I showed up for my coworkers, that I just had to do something about that. But what I really like to work with is the meaning and purpose that we bring individually, and what happens when one individual shows up alive to work and checked in and ready to serve their patients and their coworkers and their team. What does that look like? Because what happens is it starts spreading like a wildfire, and then another individual feels that way. And then you have this full team that, instead of checking out and going through those motions, they show up with meaning and purpose. And what we see in healthcare with that is, an increase in patient safety, a reduction in medication errors, a reduction in the turnover rates, things that of course are very important for what we're doing right now. But then, of course, their personal satisfaction goes up too in every area of their life, not just work, when we start paying attention to those things.
Welcome to the Improvement Nerds podcast, where we host conversations about the things that nerd us out with one goal in mind: sharing best practices and sharing techniques and tools that allow us to make lasting change. In each episode, we'll feature a different idea, and hopefully through that episode give you a set of new tools, new skills, and new thinking that'll allow you to change how you do your work, how you lead others, and how you show up in your life. We're so excited that you've chosen to nerd out with us. We hope that these episodes are exactly the things that you need to hear in order to get started in making the improvements that you want to see happen in the world. If these episodes speak to you, please subscribe to our podcast, like what we're doing, and leave a comment.
The best thing I can say is just visualizing what our healthcare system would look like if we had nurses who had come alive. I feel like if we can empower those nurses individually in a way that then they are empowering each other, and we can come together as a whole, just picturing the impact that we can have on our healthcare system and on our patients' lives, and on each other, thinking of each other as a whole person and having an outside life, and how we can really empower each other. I think that foundation, that's what nerds me out big time.
Margaret Mead said it best when she shared that one should never doubt that a small group of thoughtful, committed citizens can change the world. Indeed, that it was the only thing that ever had. I couldn't agree more. Let's get busy, Improvement Nerds. We got a lot of work to do.